three types of anesthesia available. And I like to highlight the misconceptions about the safety of general anesthesia versus IV sedation, aka twilight sleep, aka MAC, which stands for monitored anesthesia care. So let's get the easy stuff out of the way first. Not that it's easy, but stuff that we all understand. Local anesthetics. Local anesthetics come in short-acting, medium potency, and long-acting, strong potency anesthetics. And they are what are administered in the dermatology office, in the dental office, etc. And it involves simply injecting the area which is going to be operated upon, which thereby blocks the nerve endings, transmitting pain signals to your conscious brain. And the ones that are most commonly used is xylocaine or lidocaine. And patients will oftentimes say, oh, I'm allergic to that, but they're technically not allergic. Allergies do happen, pure allergies to these canes, these xylocaines, these bupivacaines, these tetracaines, these cinchocaines, these ropivacaines. Yes, you can get allergies to them, but they're relatively rare. And what patients oftentimes complain about is that, oh, there's my Bugsy there. He's not on the movie today. Anyway, what they complain about is that their heart starts racing. The heart starts going into their throat, etc. And that is the effect of the adrenaline or the epinephrine that is mixed in with the xylocaine. And what is the point of that? Well, it's the adrenaline or epinephrine which causes the constriction of the blood vessels, which is quite helpful when you're operating in the area because that means less bleeding, better visualization, more accurate performance of the surgery. Now that we have local anesthetics out of the way, that leaves us with IV sedation versus general anesthesia. I'm here to tell you that general anesthesia in most cases can be actually safer than IV sedation or twilight sleep, which is a common misconception. I have many patients that say, oh, I don't want to have general anesthesia. And there are many practitioners out there that capitalize on this naivety, where they're saying, well, we do all of our procedures under IV sedation. It's safer. No, it is not. And the issue is that when you are given IV sedation, you lose consciousness. And when you lose consciousness, you can lose control of your airway. Your jaw falls backwards, like so. And you try to breathe subconsciously, almost like deep sleep apnea. Your jaw falls backwards and occludes your airway, and you cannot move air. And you have seen this in the popular media when you've had your favorite celebrities of yore dying from drug overdoses. Because after they have had too much to drink and their bloodstreams are infused with various amounts of sedatives, drugs of some sort, it impairs their consciousness. They get in a bathtub, for example. They start to fall asleep. Their jaw falls backwards. They're unaware that they're not even moving air, and they suffocate. And that is the problem with IV sedation. It's a tightrope. You're getting an IV, and you should be done in a monitored setting. That's why it's called monitored anesthesia care. This is a mistake that happened with another very popular person called Michael Jackson. He was afflicted with this horrible problem of not being able to sleep, to the point where he had a doctor on call to administer IV sedation or monitored anesthesia care to him just so he can get some shut-eye. And the problem with Michael Jackson was that he had his monitored anesthesia care performed in a non-monitored setting. In Michael Jackson's sleeping quarters, Conrad Murray wasn't there monitoring him. From what I understood, he was in the other room eating a peanut butter and jelly sandwich, talking to his girlfriend. When he came back to check on him, unfortunately, Michael Jackson had passed away. And why was that? Well, they say it's heart failure. Well, everything is heart failure, including murder, right? But what really led to his heart failure was the fact that he lost control of his airway. He was so deeply sedated that his jaw fell backwards. It occluded his ability to pass air, to breathe. You're auto-strangulating yourself. And what happened was that he died. And so this case highlights the dangers of IV sedation. So why do we administer it? There is less hangover, so to speak, with IV sedation. And IV sedation, though, has to be performed with due diligence. When I do perform surgery under IV sedation, it's always with an anesthesiologist present who is diligently monitoring the monitors, the patient, etc., etc. It's a tightrope. It's a delicate tango dance, constantly making sure that the patient is sedated enough to be very comfortable and not feeling anything, while at the same time not being too sedated where they basically stop breathing. Whereas general anesthesia involves a tube down the throat and at the same time sits through the vocal cords. And with an excellent anesthesiologist, they minimize any problems such as sore throats, etc. from that. We use anesthetic agents which have very short half-lives so that you're left with no hangovers or minimal chance of that. I'm able to focus more when the patient is comfortable and asleep. So I'm focusing my artistry on that person. I am not distracted. Whereas IV sedation, many times, you can ask any of these plastic surgeons that do a lot of that, they have to stop midway during the procedure, that they have to reposition the head and do a jaw thrust maneuver so that the patient can then get their oxygen saturation back up to safe levels. Thank you for watching. I hope this helps dispel some of this unfounded mythology concerning the safety of IV sedation versus general anesthesia.